Allen West is a Republican and former U.S. Congressman. He joins us live from Laredo in Texas. Good to have you with us. Can I ask you a little bit about Rick Bright's testimony right now? He says that officials ignored his warnings. He says that the government response towards the corona pandemic was rife with politics and cronyism rather than based on hard science. What do you say to that?
Well, it's good to be with you, Shuli, and thank you for having me. And you're right, I'm down here in Laredo, Texas, and I cannot attest to, Dr. Bright's performance. I cannot attest to his testimony. I've been out touring around here in this city. But I can tell you that one of the things that we have to come to understand is that instead of having hearings poking at us ourselves at the United States of America, I would have preferred that our United States Congress would be having hearings about China and how China has lied and been deceptive and how China has hoarded PPE and how China was not forthcoming. I would like to have seen our CDC be allowed to go into China to the Wuhan virology lab and be able to conduct an investigation there and look at how this virus got out from that lab through into Wuhan and across the entire globe. So I don't know if he's disgruntled. I don't know his background and his work. But I will tell you that when you start to talk about something being the darkest winter in modern history, when we had the 2017-2018 flu, the common flu influenza season, we had tens of millions of Americans that were affected. We had hundreds of thousands of Americans that were hospitalized, and we also had tens of thousands of Americans that sadly lost their lives. So
well,
I don't think
just
that,
to, Alan, apologies
sure.
for interrupting, but clearly the situation is different to the flu. For one thing, there is a race to produce a vaccine. 83,000 people have died, and it's highly infectious. I get what you're saying. I get what you're saying about the flu, but you have an odd situation here where you have the President of the United States, who is not, as far as I know, a medical expert, who is touting an anti-malaria drug as a potential miracle cure and ignoring what his own public health officials are saying. You mentioned the CDC there. The CDC have made it clear they don't want US states to reopen too early because that could lead to a resurgence of coronavirus and a spike in deaths.
Let's talk about the facts. The facts is that COVID-19 has a 99.6% recovery rate. Let's talk about the facts. We know, looking at the data and the statistics, that coronavirus is most deadly for those populations above the age of 65 and also those who have underlying medical conditions such as COPD, type 2 diabetes, heart disease, or hypertension. So why aren't we focused on protecting those most vulnerable instead of coming up with some of these draconian measures? Look, I'm sitting in Texas. Texas has 29 million people. And in Texas right now, we are over 2.2 million that are unemployed. And I'm sitting here in Webb County, Laredo, Texas, which has a population of 260,000. It's the largest inland port in the United States of America. They have had, sadly, 17 deaths because of COVID-19 related illness, but they have instituted a 10 p.m. curfew. And I think that's one of the things that is frustrating. The darkest winter is going to come when you look at the fact that we have over 33 million Americans now that are unemployed. So I think that's what we should be focused on. We can do what is necessary to protect the most vulnerable. We have the data that backs that up, but we cannot sit around and quarantine an entire nation and continue to have this lockdown. And look what the Supreme Court of Wisconsin just decided, that these stay-at-home orders in the state of Wisconsin are not constitutional.
What do you say to the criticisms that if the US had acted earlier, if President Trump had taken the threat seriously at a far earlier stage, that the outbreak in the US and the number of deaths in the US would not be as bad as they are now? Do you not think it has damaged the president at all in the run-up to the next presidential election, that he is constantly having to face these accusations and trying to detract from them by saying, oh, this guy didn't know what he was talking about, or that guy is a disgruntled employee?
Well, I find it very interesting because one of the first things that the president did was to shut down travel from China. And he was criticized by being racist and xenophobic. So he did take an action. And then he also shut down the travel from Europe, and he took criticism for that. So I think those are some very early things that helped us out. And then when we got to the point where we were concerned about, overburdening our hospital systems, we instituted this shutdown, which was supposed to only go for a couple of weeks to flatten out the curve. Here in the state of Texas, we only had a 2% hospital utilization. As a matter of fact, in Harris County, which is Houston, Texas, they spent $60 million for a tent facility hospital that was never used, never saw one person. Just the same as in New York City, where they had the Javits Center and they also had the USNS Comfort. They never saw a single person. So I think that we did all the necessary and right things, but now we know that we can control this. We know who the demographics are. So we need to get this economy back open, because we're creating a worse crisis than the crisis that we were facing.
Allen, good to speak with you. Thank you very much indeed for joining us. Allen West there.